So today I'm just making a quick video on the best way to use the EMV Zoll vent for transport in our setting. So first of all, power. You can see the battery signal here tells you what percentage of battery life. And if I remember correctly, there's about 9 hours on a full battery. So check that percentage. Leave the machine plugged in here. These plugins have been a little bit finicky, so leave it plugged in here. And so just take the cord from below. You can unplug from the UPS. You'll just have to take the cord with you. You can take the machine off the rack. You slide it straight up. There we go. So you can see those two holes where it goes in. To replace, you slide it back down. So when the machine is off the cart, please protect it. Make sure it doesn't fall or anything, and also make sure all of these connections stay on. If the machine starts to ring disconnect, make sure none of these have come off. You can see here with this green one disconnected, it's starting to ring patient disconnect. So immediately check your connections, look at your patient, make sure you have chest rise, make sure they're stable. So this machine has an internal air compressor, so you can hear it generating its own air. However, it will not make its own oxygen. So we have two options to give oxygen on this machine. Option one is with your high pressure oxygen hose plugged into the wall. And then you can set your FiO2 here to whatever percentage you like. Okay, so you can do 30%. However, right now I'm not connected, so if I say make it at 88%, it's going to alarm in a minute, low O2 supply fault, because it's wanting to give oxygen, but there's none coming out. So generally what I suggest for transport, or if you're in an area like casualty or ROU, where you cannot plug in this, the other method is to sort of trick the machine. And though I say trick, this is something that they recommend, the manufacturer says it's fine. So what we're going to do is on the side of the machine, you see this little port that says fresh gas emergency air intake, do not obstruct. So the machine is drawing air through this port and compressing it to give to the patient. So if we hook something open, not closed, because again, we don't want to obstruct, to this port with a connector, and then hook to a wall flow meter or an oxygen tank flow meter at 5 or 10 or 15 liters, this hose will act as a reservoir holding your air for each breath, and the machine will then draw the air from this hose, or not the air, the oxygen, and it will allow you to give a higher dose of oxygen and give you a reservoir so you're not wasting oxygen. And so this works great in casualty or ROU. You leave your percentage set at 21% because the machine is not drawing any oxygen from here. It's drawing it, we're tricking it from here, okay? So you don't actually know the percentage of oxygen, but you can wean your oxygen based on the setting on the wall. So it can be 5 liters, 10 liters, 15 liters. So this is just a simple blue connector attached to any corrugated tubing. Alternatively, you can also use an EMV bag. And the EMV bag will just slide into that port, and then you hook oxygen up to your EMV bag. And it will, if it's drawing all the air out of the EMV bag, it will draw extra air from the room. The EMV bags can be loose and sometimes fall off. So I do find the other method a little easier. So hopefully that makes sense. So hook up your thing to the side, grab your oxygen tubing, and then titrate for 5, 10, 15 liters, whatever you need to keep your sats up while you're transporting. Your tank will last longer, whatever the lower flow you're on. So if you don't need 15 liters, if they're okay on 5, do it on 5. And again, make sure the whole time that this is going on, if you're going to be somewhere for a while, please hook back up to power, leave this one connected, connect to the wall, ideally leave it on the cart, so it doesn't fall. Thank you.